So my name is Vickie Hawkins. I have been working with MSF since 1998, so that's coming up to 13 years. And I currently work in the London office of MSF in what's called the Programmes Unit. Outside of work I have two young children, aged 4 and 2 boys. So MSF stands for Médecins Sans Frontières, with the translation of which is Doctors Without Borders. We are what is called a humanitarian medical organisation, and that means that we provide medical care to people, to vulnerable people, often affected by conflict, but also affected by infectious disease such as HIV, tuberculosis, malaria, in some of the poorest and most conflict-affected parts of the world. In Democratic Republic of Congo, we work mainly in the east of the country, in an area called the Kivus, and also in the northeast in an area called the Olays, and both of those areas are, again, the most conflict-affected parts of DRC. But we also are working in more stable parts of the country as well. We work in Kinshasa, and again that is to do with infectious disease, HIV in particular. DRC itself is very large. To fly across the country can take approximately 4 hours, and you encounter completely different geography from one side to the other. So it's a country that's almost the size of Western Europe. Diamonds come from countries such as Sierra Leone, Zimbabwe, DRC again, Angola, and MSF works in a number of those countries, DRC, Sierra Leone and Zimbabwe. And we work in those places because where diamonds are found, there also tends to be conflict, and as a result MSF finds it important to be there. So it obviously depends on actually what's happened to them, but if somebody has been directly affected by war, if they've been hurt in some way, if they have been caught in crossfire, or they have stepped on a mine or something, then the most important thing is obviously to physically tend to their injuries. But people are also impacted indirectly by war. They are sometimes forced to leave their homes. They can experience food shortages. So MSF is basically there to care for them in the way that the war has affected them. So for people who suffer food shortages, we would provide them with food, especially the kids. If somebody's been forced to leave their home, we might supply them with shelter and with a water supply. So if you are a person living in the middle of a war zone, then that's obviously a very frightening situation. There is a lot of violence around you, often on a daily basis. People that you know can be, they can be hurt because of that violence. People become traumatized, so it can have a very severe effect on your mental well-being. And people are sometimes forced to leave their homes. And all in all, it can be a very frightening and traumatic experience. People also can live through war for decades, so there can be children born in countries like DRC or Afghanistan who have never known peace. That's all they have grown up with. For someone like myself who has worked in a war zone, it's obviously a different experience. I'm there for a professional reason, and I have to treat it in a professional way. But I think it's also very important when you then come home to recognise that you've lived in a violent situation yourself, and that potentially you need to look after yourself because of that. Refugees are people who are forced to leave their home because of war. When they leave their home, they sometimes seek protection in another country, so they cross an international boundary, and that is what constitutes a refugee, somebody who has gone into another country. Other people who leave their home, sometimes they're not able to cross into another country, sometimes the other country closes their borders and people actually physically can't cross. They are called an internally displaced person, but it's basically the same situation. They've been forced to leave their home, they often have very little with them, they've sometimes had to leave family members behind, and obviously that's a very distressing situation for people. Our first goal is to provide them with medical care. So when people are displaced, they often gather into large groups. They find some form of protection in numbers. So we're there and we set up clinics. We can provide water for them, shelter, and sometimes psychosocial support as well to help them with the trauma that they've experienced. Part of the healthcare that we provide would be some basic vaccinations, but also we would be on the lookout for the outbreak of disease. So in particular, measles is a disease that can affect, that can run right through displaced groups, and any sign of a measles outbreak and we would instantly be vaccinating all the children up to the age of about 12. And for malaria, we would be distributing anti-malarials and bed nets. That would be the other thing. It's very important if you're in a malaria affected area that you sleep under a net, because that will actually protect you. It's the first kind of method of prevention for actually getting malaria. Sleep under a net so the mosquito can't get in. So human rights are something that we all possess as an individual. They are something that we are all entitled to. So there are different types of rights. So a very basic right is the right to life. We all have the right to continue living and nobody has the right to take that away from us. The rights to healthcare, the right to an education, the right to live kind of free from fear of violence and persecution. We find some rights very important: the right to healthcare, the right to life, and the right to humanitarian assistance. So if people are living in the middle of a war zone, then they have the right to receive assistance from us. So that is the way that we try and safeguard those rights, to be there providing them the humanitarian assistance that they need and deserve. But also governments have a responsibility in terms of human rights. They have a responsibility to preserve the human rights of their citizens, and if we feel that governments are not preserving those rights, then sometimes we will talk about that to the public. We might talk about that to a newspaper or to the television, to draw attention to the fact that we feel the government is not protecting its citizens in the way it should.